Hi, I'm here with Dr. Marc Leibole, and noted eye physician. Is that safe to call you a noted eye physician?
Sure, sure.
And he practices in Newton, Wellesley. And what's the official name of your practice, doctor?
Eye care and laser surgery of Newton Wellesley.
Now, I had LASIK laser eye surgery. I'm possibly one of the world's biggest fans of LASIK laser eye surgery because I had it, it's over 14 years ago now. And my glasses were so thick. Remember the old stories about Coke bottle lenses? That's what my glasses looked like. My right eye was like 2400, my left eye was 2200 minus, and now I don't need glasses, and it's fantastic. Now, in the past 14 years, I would imagine a lot of things have changed.
They have. There's been big changes. The biggest change is probably the safety.
Really?
Right, and
You tell me that now.
yeah, but you're doing well, fortunately.
Yeah.
The way that the flap is created with LASIK, there's a flap created. That flap is reflected back to expose sort of the central cornea, which then the laser is applied to the central cornea. That gets rid of your nearsightedness, your astigmatism, your farsightedness, and the way the flap is created used to be with a mechanical blade, which could cut too thick, too thin. Normally it was pretty good, but if it cut too thick, it could actually perforate the eye.
Really?
Or too thin, it could create an uneven flap that wouldn't, what's called a free flap. And that was really the biggest risk of the entire surgery.
Well, how do they do it now?
So now it's blade free, we use a laser.
Really?
Right, so there are two lasers. The first laser is what's called the intralaser. And the intralaser, you pre-program it for how thick I want to create the flap, and it will cut to within a few microns of what I program the laser.
Wow.
And so that's really, really made it a lot safer.
I would think maybe that would help healing faster too.
Significantly.
Great.
Less chance of the flap dislocating after surgery. Now that's very rare. Before that was a bit of an issue. And then some of the other big improvements are the wavefront guided lasers. Before, what would happen if you saw me 10 years ago, and I would program into the laser what your prescription was, basically what I measured in the office. Now, an aberrometer, a wavefront, basically aberrometer, which is like a laser.
Because you're way over my head right now.
Yeah, sorry. So something NASA created ways of measuring vision that are much more precise than we can make in our glasses.
Wow.
Right.
Wow.
Right.
And even more precise than you can get with a contact lens?
Much more precise.
That's incredible.
And what they correct now for, or what we correct for, not just nearsightedness, farsightedness, astigmatism, but what are called higher order aberrations. And those are the aberrations that might make your night vision more difficult or cause more glare and halos.
Because I read someplace that anytime after 40, you need maybe like 20 times as much light at night to see properly?
Yes.
And you can help that too, huh?
The laser will help night vision. It used to be that night vision almost always was made worse by the laser surgery. Now I don't tell the patients it's going to make it better. It often does, but it will not make it any worse at all.
That's fantastic.
Right.
Now, for the average person who has no idea what to expect, they're afraid because, you're talking about somebody doing something with your eyes. What is the procedure? How long does it take you to heal? What precautions do you take? How long before you can go out and ski or play golf or go swimming?
Right, a great question. Basically, the next day, you can do most of your activities.
Wow.
No swimming for a week to 10 days just because there's some bacteria in the pool that we want to avoid. But now, the recovery is basically overnight. The day of the procedure, the patients need to kind of lay low and take it easy. But the following day, they drive themselves into the office. The eyes feel a little dry, but really other than that, they don't really feel much of any consequence of the surgery other than much better vision.
It's fantastic.
Yeah.
I highly recommend it.